Hi, this is Dr. Thomas Gibbs in Glen Ellen, Illinois, and welcome to our webinar on the 10 deadly dangers of missing teeth. I made this because so many people have lost teeth or missing teeth, and they don't really know what the problems are long term of these problems. One of the big dangers there is bone loss. Major cause of wrinkling, premature aging. When you lose the teeth, you will lose the bone. You will lose actually 40 to 60% of the bone that used to surround the roots of the tooth within the first 1 to 2 years. It progresses indefinitely, and big problem. That's one of the primary reasons you want to get something like an implant placed before the dentures become loose, before you lose the bone. Before you get the bone loss beneath the bridge, whatever the problem you have there. If you have to replace that bone with bone grafts, why do it unless you have to? Don't wait till these things become a problem. Take a look at this diagram here. You can see progressively how that bone is lost, bit by bit by bit. That's width-wise, height-wise, even density-wise. Another problem we have that type of situation is, even though it does not look like you're losing bone, you can actually be losing density of bone, or in the case of the upper back teeth, when you lose the roots, the sinus miraculously grows down and hollows that bone out. And boy, people who need implants placed then need things like sinus lifts and bone grafts. Again, don't wait. Another problem we have here, we get some people think, geez, I don't have to replace my back teeth, they aren't showing, and you find out that the back teeth support the front teeth. This lady had no gaps between her teeth 10, 15 years ago, and now look at the problem. She's lost her back teeth, the front ones lost their support, and they're moving out, they're moving forward to get these gaps. Eventually end up with gum disease and losing the front teeth. So again, not another situation we want to wait for. Another thing that can happen here is you lose the tooth. The teeth that used to bite against it will drift either up or down depending on which tooth. The teeth in the back of it will drift forward. The teeth will get into situations where you can get increased incidence of gum disease, tooth decay. As they shift, they lose their stability. You get food caught between them. All sorts of problems that you just don't want to see. And by the way, this is something we actually see frequently being a dentist. Certainly another problem you have here is the change in biting efficiency. If normal teeth, you would be chewing with 100% capacity. Lower denture, you're down to 10%. You go all the way to implant overdenture, you go up about 60%. Implant supported bridge, about 90%. And that's really the reason why the cheeks will sink in. You've seen this, I'm sure, with many of the older people. If you're chewing with 10 pounds of force with a denture, you work for 150 to 200 pounds of force with your teeth, your face muscles will atrophy, they shrink up. That's the real reason why you get that sinking in the cheeks. It's not that you don't have enough bulk in the denture. It's you've lost everything you started with. Again, your whole face will change, even height-wise. It's not just the sinking in the cheeks and the wrinkles. Look how, I'm sure you see many people just like this. You lose the height of the bone, you lose the muscles, your whole face changes. Partials, dentures, certainly not the ideal solution here. Those clips on that partial there will kind of torque those teeth. You'll get plaque retained in those areas. They will still move around there. They will still get bone loss between those back areas. Situation gets worse over time. Take a look at some numbers here. An astounding 17% of denture wearers actually chew better without dentures. Isn't that amazing? Emotional aspects, sadness, depression, self-confidence. Many of these people actually cannot go out in public. They're worried about things falling out, let alone being out. I've had people say they've not been able to go out for dinner in 10 years, let alone they even visit relatives. What is an implant? Think of implant as being like a artificial root made of pure titanium. The bone fuses to that implant, strong, highly biocompatible Success rates over 20 to 40 year span in the 98% range. They can be used by themselves, a crown, or tied together to replace dentures, support dentures, lots of applications. Big thing is it preserves what you have. Take a look at these success rates I was talking about here. A removable denture, you're down to 5-year success rate of 83. Over a 10-year, that goes down to about 50%. Or again, those implants are staying about that 98% range. So why live with these problems? The psychological problems, the social problems, the chewing problems, the not being able to feel your food problems, the face problems. There are alternatives. We do have experience in doing this. You do have to have a lot of experience and training to do these sophisticated implant procedures. Although certainly I would think that patient feedback, patient photos would be our best credentials. Take a look at a quote here from Dr. Mayo, the Mayo Clinic. Presence of dental health is important. Dentistry is a distinctive health service that can extend human life 10 years. So there are solutions. Look at our other videos, dangers of dentures, solution videos on what are implants, how they can use to replace crowns, partial bridges, and even our one on implant alternatives to dentures. Fear is a factor. We do have videos on comfort, relaxed dentistry, and sedation. So certainly visit our website, fearlessdentalcare.com. Call the office, 630-858-8800. Or if you just want more information, request a leave your email or address, whatever you prefer. And we'll at our toll-free 888-371-0641 number, and we'll get you some more information. So look forward to hearing from you in the future. Thanks for listening. Bye-bye.